Today we're going to talk a little bit about idiopathic lung disease, which there are a number of conditions. I saw a lady the other day with a condition she was diagnosed, which is all part of this, pulmonary fibrosis. And it's where the lung tissue becomes scarred because of some type of, whether it's pollution or genetic or some kind of situation where you get this chronic inflammation within the lung tissue, and the repair mechanism causes scarring. So once you scar the lungs, you've lost those alveolar sacs. You cannot exchange oxygen and carbon dioxide in the blood, in the lungs. And basically, it's like your lungs becoming like calluses on your hand. The tissue doesn't work, and you slowly lose your lung volume, and it eventually kills you because there is no way to reverse it if you look at the literature. However, there is hope. And been reading a lot lately of maybe you can reverse scar tissue in the lung. Years ago, a girl came to me who had her foot badly burned, and was in the burn unit, and eventually got better, but she couldn't run. She couldn't do really any exercise because the scar tissue made it so that she couldn't move her toes, and her ankle was stiffer. So she didn't have any flexibility. So I knew that umbilical cord stem cells can revert scar tissue back to normal tissue. So we gave it to her, and 6 months later, she's at the gym, she's wearing high heels, she's working out, she's running, she's back to normal. So I had a patient come in to see me with pulmonary fibrosis, and I said, let's try this. So I gave him umbilical cord stem cells as an IV, and 6 months later, this guy was without his oxygen. Just normal life, no more oxygen 24 hours a day. Then, been reading more and more lately about using umbilical cord stem cells, but using exosomes. Exosomes are very specific for fibrotic tissue and chronic inflammation. And in looking at those early studies, there does seem to be a reversal in pulmonary fibrosis. And it's one of the things that we're starting to do here is take the stuff that I've done in the past, take some of the newer literature out there showing that stem cells and exosomes seem to work even better. But in our early studies, I'm saying that it may not be true that there's nothing you can do, because we're pleased with what we're seeing in our patients, that they seem to be getting better. They don't need the oxygen as much. It's not a quick fix. It can take, almost 3/4 of a year before you may see signs of improvement. But there is a possibility that by doing certain things, you can reverse a disease that they say is irreversible.